Good morning, everyone. My name is Kristen Zeyer. I am an account manager at Infinity Benefit Solutions, and today we are going to be talking about Health Insurance 101. The topics that we will be covering is what is health insurance, different types of health insurance terminology, and what to do when you need help understanding your coverage. So first of all, what exactly is health insurance? Health insurance is an arrangement with an insurance company. This can protect you from the high cost of healthcare. At its most basic, you pay premiums and the insurance company agrees to pay part of your medical expenses for illnesses or injuries, prescription drugs, and preventive care. Health insurance works by spreading the cost of risk among large groups of people, so insurance paid by one person helps pay for the care of others. In a large enough group, most people are healthy and use few health services in a given year. A minority of individuals account for the majority of healthcare spending for the group. Because it is likely that every person will, at some point, get sick, be injured, or even become disabled, sharing this risk is a critical part of insurance. In addition to spreading financial risk, health insurance has another important function: improving access to healthcare services. In general, doctors and hospitals are more likely to care for people when they know they will be paid. Numerous studies have shown that people without health insurance receive far fewer health services or delay health care when it's needed compared to insured people. Health insurance not only protects individuals from catastrophic expenses, it also improves access to important routine, preventive, and primary care services. So now we're going to talk about different types of health insurance. So first and foremost, we have group health insurance. So if you are an employee who is on your health insurance through your employer, this is the type of insurance that you currently are enrolled in. So group health insurance coverage is a policy that is purchased by an employer and is offered to eligible employees of the company and often to the employee's family members as a benefit of working for that company. A group health insurance plan is a key component of many employee benefits packages that employers provide for employees. The majority of Americans have group health coverage through their employer or the employer of a family member. One of the advantages for employees in a group health plan is the contribution most employers make toward the cost of health coverage premium. In many cases, employers pay half or more of the monthly premium for an employee. Another type of health insurance is individual health insurance. This insurance, quite simply, is coverage that an individual purchases for him or herself and his or her family, if needed. Individual insurance policies and provisions are regulated by the state where the policy is purchased. Individual policies are often purchased with the advice of a professional insurance producer due to the complexity of coverage offerings and the premium cost. And then lastly, we have government-sponsored health insurance. So government-sponsored health insurance is coverage obtained through a government agency or program. This type of insurance usually requires a special condition, such as elderly, low income, children, veteran, or active service member, or Peace Corps volunteer, in order to be eligible. Costs in this plan are split between the government and the insured. So next we have this little word cloud here, and it's going to show you a lot of terms that you probably have seen thrown around if you have been exposed to health insurance at any time of your lifetime, and that can be kind of confusing. As I said, there's many terms that are thrown around, and understanding the terms is going to help you understand the costs and the benefits and estimating the costs associated with receiving care. So once you understand these terms, you'll be able to essentially decode what is happening within your health insurance plan much easier. So the first one that we are going to start out with are terms that are going to relate to the participants. So first we have a provider. So a provider is the healthcare professional that you are going to see at the clinic, hospital, doctor, lab, pharmacy, primary care doctor, anything like that those are going to be referred to as providers, and they provide the actual medical services. You'll also hear the term insurer or carrier, so those terms can be used interchangeably. This is simply just the insurance company that is providing the coverage. You also have the policyholder. So this is going to be the individual or entity that has entered into that actual contractual relationship with the insurance company. And then lastly, we have the insured. This is probably you if you have health insurance coverage. It's simply the person who actually has the coverage. Next, we have the premium. So I like to think of the premium in terms of dollars. So this is the amount of money that is charged by an insurance company. So, you're likely paying your premium on a biweekly basis if that's how you're paid. And so the employers determine how much of the premium employees must pay for coverage. This is usually done on a pre-tax basis. So there is a little example down here. As you can see, Mary has her gross pay. Then the employer deducts the premium from her gross pay. Then you have her adjusted pay. And the adjusted pay is what actually is taxed, and then that equates to her take-home pay. Next, we have the copay. So this is a fixed amount that you would pay for a covered healthcare service, usually when you get the service. These amounts can vary. Very common ones that you will see copay for are office visits. So for example, your primary care physician, and then if you go to see a specialist, those are typically going to be different copays. Urgent care often has a copay, and then emergency rooms also have a copay often. You'll also see this with prescriptions through your health insurance plan, is that you'll typically have a copay. So in this example here, you can see Sally takes her son to the pediatrician. The true cost of the visit was $200, but through her insurance coverage, she only has to pay $15 because that is the copay for the visit, and the health plan is actually going to pay $185. Next, we have the deductible. So the deductible is the amount that you will owe for healthcare services in the year before the insurance company begins to pay. So in this example here, John's deductible is $1,000 annually. He unfortunately fell off of his roof and he has to have 3 knee surgeries. The first surgery is going to cost $800. John has not paid anything toward his deductible yet. And so in this case, John will be responsible for 100% of that surgery, which is $800. Next, we have coinsurance. So coinsurance is your share of the costs of a covered healthcare service, and this is calculated as a percent of the allowed amount. So coinsurance doesn't actually kick in until your deductible has been met. So in this example here, John, he has a $800 surgery and he had to pay the full $800. He has $200 left of that, and so he would have to, for his next surgery, he would pay $200, and then the insurance plan would pay 80% of the next amount of costs. So that's where the cost sharing really begins to come into play after your deductible has been met and the coinsurance now takes effect. Then we have the out-of-pocket maximum. So the out-of-pocket maximum is the most that you would have to pay for your healthcare during a year, not including that monthly premium that you're paying for the insurance. This does protect you from really high medical costs. If you, let's say, for example, had some type of catastrophic event and you had $500,000 in health insurance claims, as long as everything was in network and covered through your plan, you would never have to pay more than that out-of-pocket maximum. So after you reach that, the plan will pay 100% of covered healthcare services for the rest of the year. And next we have preventive care. So this is going going to refer to measures that are taken to prevent chronic illnesses. The goal of preventive care is to keep you healthy, to catch illnesses in the earliest stages so that they can be treated and you can go on to live a long and happy, healthy life. Some examples of things that are included in preventive care are medical tests, immunizations, screenings, medications that are preventive, and any other services that would be considered preventive. And just so you know, the ACA was passed and basically determined that all non-grandfathered health insurance policies must provide preventive care services each year at no cost to you. And so if you are enrolled in your employer's group health plan, make sure that you are going in and getting your yearly checkup because that is going to be covered for you at 100%. So next I have a chart here that I want to just show to highlight how many people actually don't have a great grasp or understanding on their health insurance benefits. And so this blue line here is going to show you the percentage of people that agree with the statement, and then the red line is going to be the percentage that disagree. So I'm not going to go through every line here, but for example, we'll start with the top one. Don't know enough about how to leverage their company-provided health benefits. 63% of people agree with that. And so that is, one of our goals here is to help educate you about your health insurance so that you can go out there and make better informed decisions. There probably will be instances where you don't understand what to do or how to read the statements that you're getting from your health insurance company and you need help. So that's totally understandable. The world of health insurance is complex and it can be very confusing. And that is why we at Infinity Benefit Solutions are here to help you. So we are here as a resource for you. We can help you with all different types of questions that might come up, such as finding an in-network provider, understanding which services will be covered and how they will be covered, understanding your explanation of benefits, helping to set up your online portal through your insurer, and then also helping to navigate those claims, which can be very confusing. So don't hesitate to reach out to your Infinity contact for help. All right, thank you, everyone. Hopefully this provided you with some good base knowledge to understand your health insurance benefits a little bit better. Thank you.